Welcome to Care Credit Connects, conversations with successful office administrators, leading dental educators, and other key opinion leaders who share their best practices on topics ranging from attracting new patients and patient engagement to post-care follow-up and social media strategies. I'm Angela Martinez, Vice President of Strategic Associations, and joining us by phone today is Jenny Reed, the Practice Administrator at Keystone Dentistry. Thank you so much for joining us today, Jenny. We appreciate your time and willingness to share your experiences, insights, and ideas with other practice administrators across the country. Greetings and welcome.
Thank you very much. Happy to be here answering any questions that you have in regards to myself, my practice, and practice management.
So, Jenny, let's start with your personal journey, where you started and how you got in your current position as practice administrator. Was dentistry or healthcare something you always wanted to do?
Well, it was kind of a fluke. I actually graduated from college with a degree in elementary education and early childhood. So I have a bachelor's in that. And so I didn't get into the teaching field. I ended up working for a local community college. Fast forward to 4 years later, I was very unhappy where I was. And my best friend for years, she worked at the UMKC School of Dentistry. And so they had an opening in the faculty practice where it's a private practice for the faculty doctors that teach in dentistry. So she said, we have an opening for a recall and accounting coordinator. Would you be interested? And I said, I have no idea what any of those are, but I would be willing to try to get out of the situation where I was in. Her boss came out, interviewed me, hired me right away. And so working in the faculty practice, you have 30 doctors, basically, and 3 hygienists. So I kind of compared that to a crash course on dentistry. So from there, I just kind of took off. I was with the faculty practice for 2.5 years, and that was 20 years ago when I started working for them. I got to be really good friends with a doctor down there that basically practiced for 5 days a week. So 2.5 years later, he said, hey, I'm getting ready to buy a practice, and would you like to come work for me and run it? And I said, okay. So I took a leap of faith, and so that was April 1st of 2002 when he took over for the practice. So it was hit the ground running. So I've been his practice administrator for 17 years.
That's quite a journey.
Yes, it is.
And quite the crash course at the start of your career. That's incredible. Well, I guess you're the type of person up for a challenge and definitely a fast learner. Let me ask you a big question. If you had to choose just one thing that dental teams should do to help their practices thrive, what would it be?
Cooperation. Everybody pitching in and helping out. I see one too many practices that certain people are like, that's not my job. That's not my job. That's not my job. And when teams can understand that we're a team, we're working together. It's all of our job to make it to the finish line. And for me, the finish line is the end of the day. And when you have some people that aren't cooperating or, have that it's not my job mentality, then that really puts a damper into management of the practice and also team morale.
Wow, that's a great point, Jenny. It's hard when there's someone on the team who isn't really a team player and doesn't pitch in and do their part to make the practice operate efficiently and effectively. Let me ask you another big question. If you had to say what is the one thing you feel your team does that is unique and contributes to the practice success, what would it be?
We are really good at communicating.
Okay.
No practice is perfect. Our practice is not perfect. This is something that I was telling my husband the other day and something that we were talking about at work the other day is that we are really a great team. We hand off really well. And I hate to use the term back office and front office because that implies a division in your practice. But I think that our administrative team does a great job of communicating to our clinical team about a certain patient that calls, we have them on the schedule, we get more information from the patient, we communicate that back to our clinical team so that when a patient comes in and the dental assistant sees the patient, instead of saying, well, what are you here for today? They already know in advance because we put it on the schedule. We've communicated that to the team members. And when the patient sits down, that the assistant goes right into, well, I understand you're having a problem with one of your teeth or the upper tooth or the tooth that we worked on last week. We try to do a great job of communicating. The clinical staff communicates very well with the administrative staff when they're walking out the patient. They just don't dismiss the patient and let them go to the front desk by themselves. They're actually escorted, and the clinical staff will tell, or the assistant or the hygienist will tell my checker out person, quote unquote, this is what we did today to Mr. Green, so that whatever they have walked out or put in the computer matches what they're verbally telling them. We do a great job of communicating to one another. We're a very cohesive unit. We have lunch together every day. We talk about things at lunchtime. It's very different in the fact that we all enjoy working with one another. We respect one another. Are there days that, one of my hygienists is very moody? Yes. And, everything is not perfect and all sunshine and roses every day, but for the most part, we get along and we communicate and we respect one another.
I agree. Respect and communication are important. When the practice is busy, it's so easy to unintentionally miscommunicate, which can lead to misunderstanding, hurt feelings, and stress. But great communication is rarely a talent that someone is born with. It's a skill set that you need to learn. Is there anything else that you can think of that contributes to the success as a practice, as a team, and maybe personally?
Our practice is very much geared on education because our owner doctor taught down at the university. He is always in education mode. So we try to educate the patients as much as possible. And that begins with the new patient phone call. When the patient calls and schedules an appointment, we try to educate them on, this is what you can expect for your first visit. We're going to do a new patient exam. We're going to check out your periodontal pocketing. We're going to do x-rays. If you have x-rays from previous dentists, you can transfer them over. Yes, we work with your insurance company. We will give you a better idea when you come in on how that works. So everything from educating patients on the treatment that they need, educating them on why they need that treatment. So oftentimes patients will come in and doctors will say, well, you need to have a root canal. We'll make sure that they understand, if they've never had a root canal, they'll make them understand what's involved in that treatment, why we need to do root canal treatments. So our doctor does spend a little extra time. Our hygienists are very good on educating patients. So if they have periodontal disease, what exactly is periodontal disease? Why aren't you eligible for a regular cleaning, like a prophy that your insurance says pays for 2 times a year at 100%? Why are you not eligible for that prophy 2 times a year? Really, the foundation of our practice is education.
It sounds like your team is very much focused on patients and having them be a part of their oral health journey through education and communication, and as you mentioned, cooperation.
I think we give an excellent patient journey because of the cohesiveness of our team. It never seems like one person doesn't know what the other person is doing. From the new patient experience of patients coming in, again, part of that education is, are you looking to establish yourself as a new patient? Do you have something going on that you would like to discuss with the doctor? All of those notes go into their patient screen so that when, from the handoff of the front desk to the patient, the clinical staff knows what's going on with the patient. Hey, welcome to our practice. I see that, we're going to do some x-rays today. I see that you're having problems with the tooth. We're going to take an extra x-ray of that tooth to see specifically what's going on. What is it that you don't like about your smile? Is there any procedures that have you ever thought about having straighter teeth? Or, and oftentimes we let the patients take the lead of, tell me what is concerning you the most so that we can do up treatment plans that are geared towards the patient's needs and the patient's wants. And then again, that handoff from the clinical staff to the administrative staff, putting together the treatment plan. So it's just a very, very smooth process when, from the comprehensive exam to the cleaning to dismissing of the patients to giving them a treatment plan when they leave so they know exactly how much it is that they're going to need when they come back in. Again, it kind of loops back to that communication, everybody on the same page and communicating to one another, because that not only works great for the staff, but it also works great for the patients so that they can see, well, they really got their act together because everybody knows what's going on. Patients know from the assistants writing up the patient notes, what exactly do they need on their next visit? So when they call and they say, well, I was here last week and the doctor said I needed to call and schedule an appointment. And instead of saying, well, what is that appointment for? We get their name, we pull up their notes. There it is right there. Patient calling for a build-up on to number 15 so that we know exactly what it is that we're scheduling. Oh, yes, Mr. Jones, I see here that we need to schedule you an appointment for a build-up on number 15. So let's go ahead and get you scheduled. Again, it all centers back within the communication.
I agree. So much centers on communication, especially relationships. Let me ask you, what is the outcome when patients have a great experience at your practice? How does that impact the patient, your practice, you professionally, and you personally?
Well, it always feels great. And Dr. Myers he works very closely with a group of residents from another college and also the one down at UMKC. And oftentimes, with the patient's permission, he uses these as teaching moments, from their x-rays to treatment planning to the outcome. And it makes us feel great. We do work with Solution Reach, and so, patients will leave great comments. We celebrate together, and it's really a great internal feeling knowing that you have a new patient that comes in that wants to tell everybody about their experience. For the most part, our practice is located in a smaller town. So word about the great performance that you give for your patients spreads. And I know this is kind of a small thing, but when you are a member of that community Facebook page and somebody says, hey, I'm looking for a great doctor in such and such area, you see people that recommend your practice. It's something as little as social media, people talking on social media about your practice and about their great experiences that they've had with your practice. The patient feedback that comes through the Solution Reach when we send out surveys. How was your experience? Anything we could do better? And we get things back. The team was so nice and they listened to me and it was painless dentistry. And that just really makes you feel good and it validates what it is that you're doing.
Jenny, it's funny you mentioned the Facebook groups because whenever I see somebody recommend my own personal dentist or doctor on those community groups, I get excited for them, that other people love them too. And I think that kind of advocacy starts with the patient experience, their journey to oral health.
Right. Exactly.
We really appreciate that you agreed to share your experiences and insights with peers. So we know that you accept the CareCredit credit card, and we'd like you just to take a few minutes to talk about any tips that you might have to help other office administrators get the most out of the program.
The most value out of CareCredit. Okay, so let me think about this for just a moment, because it goes way past CareCredit. It goes into treatment planning and giving options for your patients, because there's one too many times where you have a patient that comes in, needs to have a root canal buildup and a crown, and this is how much it's going to be. Oh, well, I can't afford that. So the way that dental offices will get the most value out of CareCredit is becoming knowledgeable with the program, knowing what the options are. What are the payment options that you can present to your patients, and just familiarizing yourself instead of saying, well, here, you can apply for a CareCredit card, and you can pay them back. Or you could say, well, we work with a great third-party financing company called CareCredit. They offer no interest payment options up to 12 months or 18 months. So that way you'll be able to pay them back within the 12 or 18-month time period. And as long as it's paid off within that time period, you don't incur any kind of finance charges or anything. So I believe that from your treatment plan coordinator to your clinical staff, everybody needs to know the ins and outs of CareCredit so that they can pass that on to the front desk. Because when the doctor comes in and says, well, you're going to need a root canal buildup and a crown, I'll be right back, I'm going to go do a hygiene check. Then the patient inevitably will look at the dental assistant and will go, oh my God, how much is that going to cost? It's the first thing that they blurt out of their mouth. And then they need to prepare the patient for the handoff. Well, I tell you what, we're going to have Susie at the front desk do up a treatment plan for you. We're going to look at all of your payment options. Well, I don't have insurance. Well, we can talk about Care Credit. Our office works with Care Credit. We'll be happy to give you information about that. Just knowledge across the board, not only that we offer it, but basically to kind of give them the gist about it, if you will.
So, Jenny, what do you say when patients ask to make payments?
Typically, our response is that if you want to make smaller payments, we work with a great third-party financing company, which is Care Credit. For me, Care Credit will always come up when anybody ever asks, do you guys take payments, or can I make payments to your office? So that's always a lead-in to the presenting of the Care Credit. We do have brochures. We have the displays. We have the brochure holder. We have a fair amount of Spanish patients in our practice, so we do also display the Spanish versions. We also do Invisalign in our practice, which Invisalign has a partnership, or Align Technologies has a partnership with Care Credit. So we do have Care Credit geared towards Invisalign, pay for your ortho treatments with Care Credit. We do have those. We've got them in the treatment operatories. We've got them, in the check-in, check-out with the tables around. We've got a link on our website to Care Credit. We do advertise it in our practice, but verbally, it's typically when the patient knows how much it's going to cost, and now we're going to present your payment options.
Jenny, thank you so much for taking time to share your ideas and insights with us. If there is just one thing that you hope listeners to take away from your story, what would it be?
Cooperation. Everybody pitching in and helping out.
Excellent, and thank you again. I'm Angela Martinez, and I'd also like to thank our listeners for joining us for this edition of Care Credit Connects.
This content is subject to change without notice and offered for informational use only. You are urged to consult with your individual business, financial, legal, tax, and/or other advisors with respect to any information presented. Synchrony Financial and any of its affiliates, including Care Credit, collectively Synchrony, makes no representations or warranties regarding this content and accept no liability for any loss or harm arising from the use of the information provided. Your receipt of this material constitutes your acceptance of these terms and conditions.